Welcome to my YouTube channel. Our today's topic for discussion is key facts about commonly prescribed antibiotics. Our first class of antibiotics for discussion is quinolones. These medications have fluoxetine in their names. Adverse effects of quinolones: QT prolongation, tendon damage, convulsions, heart valve regurgitation, aortic aneurysm. Indications for quinolones: prostatitis, acute otitis media, eye infections. Drug interactions for quinolones: QT prolonging drugs, increased risk of QT prolongation, corticosteroids, tendon damage risk. Nonsteroidal anti-inflammatory drugs, seizure risk. Methotrexate, increased levels. Theophylline, increased levels. Counseling points for patients using quinolones. Patients should report any tendon pain, CNS effects, peripheral neuropathy. Precautions for patients using ciprofloxacin tablets: avoid milk. Indigestion remedies or medicines containing iron or zinc 2 hours before or after administering. Our second class of antibiotics for discussion is tetracyclines. These medications contain cycline in their names. Indications for tetracyclines: respiratory infections, acne, rosacea, periodontal disease. Adverse effects of tetracyclines. You can remember adverse effects by word post: P for photosensitivity, O for oesophageal irritation, S for severe headache or visual disturbances, T for tooth discoloration. Drug interaction for tetracyclines. Retinoids: increased risk of benign intracranial pressure. CYP3A inducers: reduced doxycycline half-life. Methotrexate: increased levels. Lithium: increased levels. Precautions for using tetracyclines in pregnancy. Avoid using tetracyclines; it may cause discoloration of child's teeth. And effects on skeletal development. Precautions for using minocycline. It may cause irreversible pigmentation. Our third class of antibiotics for discussion is penicillins. These medications contain "cillin" in their names. Indications for using penicillins: prostatitis, acute otitis media, eye infections. Adverse effects of penicillins: diarrhea, antibiotic-associated colitis, hypersensitivity, skin reactions. Hepatic disorders can increased risk with using flucloxacin and coamoxiclav. Drug interaction of penicillins: warfarin, increased INR risk. Allopurinol, risk of rash. Methotrexate, toxicity risk. Precautions for using flucloxacin, also known as phenoxymethylphenolic, take it on an empty stomach or 1 hour before food. Our fourth class of antibiotics for discussion is metronidazole. Indications for metronidazole: oral infections, bacterial vaginosis, H. pylori. Adverse effects of metronidazole: taste disturbances, dark urine. Liver enzyme increases, nausea, vomiting. Drug interaction of metronidazole. Cyclosporin, levels may be increased. Warfarin may increase INR. Phenobarbital, metronidazole metabolism increased. Lithium, increased levels. Reaction of metronidazole with alcohol. Avoid during the course and for at least 48 hours after. Risk of disulfiram-like reaction. Counseling points for using metronidazole. Take with or just after food or a meal. Our fifth and last class of antibiotics for discussion is nitrofurantoin. Indications: it is used for urinary tract infections. Adverse effects of nitrofurantoin: blood disorders, acute pulmonary reactions, cholestatic jaundice, peripheral neuropathy. By using nitrofurantoin, it may discolor urine. It should be avoided in pregnancy. Counseling: take with or just after food or a meal.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.